Good morning. My name is Joy Harris. I am the Director of Education Services for PHAB. We're here to talk about reaccreditation. Accreditation is one of PHAB's tools for transformation, just to kind of get the logistic things taken care of. Zoom does have a closed caption feature that you can turn on if you like closed captioning. We are recording this so we can post it for others to view. We would encourage you to use the Q&A versus the chat, but both are enabled. We'll really be monitoring the Q&A for questions. We hope that you'll ask us questions as we go, and we'll try our best to answer those as we go and leave time at the end to answer those questions. And I think I've covered logistics. So I'm going to introduce myself one time and introduce you to my PHAB colleague, and then we'll get started on content. So as I said earlier, my name is Joy Harris. I'm the Director of Education Services for PHAB. I've been with PHAB almost 2 years. I came to PHAB from the State Health Department, and I'm coming to you from Johnston, Iowa. And with me today is Amanda Marino, and I'm going to have her introduce herself to you.
Thanks, Joy. So good morning or afternoon, everyone, depending on where you are. My name is Amanda Marino. I'm the education specialist here at PHAB. I have been here for almost a year, in just a couple of days. And I am located in Northfield, New Jersey.
Thank you. All right, I'm going to share my screen. And we are going to get started. So I wanted to start, that shouldn't be there. I wanted to start with who is PHAB? We know that there's been some turnover in departments, and as we're talking about initial accreditation to reaccreditation, just wanting to spend a couple quick minutes talking about who PHAB is. So we are the Public Health Accreditation Board. Our mission is here to advance and transform public health practice by championing performance improvement, strong infrastructure, and innovation. We really see accreditation and reaccreditation being a pivotal part of that mission. We are the accrediting entity for local, state, and tribal public health departments. What you may not know is that we're also the accrediting entity for vital records and health statistics units, as well as military public health departments. We really prioritize working with the field to develop our products, to continue developing them. And I hope if you don't know us and haven't been involved before, that you'll take advantage of opportunities to review standards and measures or provide feedback on processes. Even you providing feedback on training today. So that's a little bit about PHAB. Oh, and we are all located in Alexandria, Virginia, and have a remote workforce across the country. So you all are here to talk about reaccreditation. So let's get started. So what is reaccreditation? PHAB's accreditation timeframe is 5 years. So reaccreditation is the process where you apply for reaccreditation 5 years after you've achieved initial accreditation. Through reaccreditation, just like initial accreditation, you are looking at meeting a set of national standards and measures. These have been developed specifically for reaccreditation. So a little different from initial accreditation. Why do folks do reaccreditation? These are kind of the 3 main reasons that we talk about and that we've heard different variations on. So first, it's really about demonstrating continued accountability, that you continue to strive toward that culture of improvement, that you're continuing to work to meet best practices, national standards and measures, and really being able to talk about that with your partners and stakeholders. Reaccreditation also is kind of a push to continue to evolve, improve, and advance, because you're looking at those best practice standards. You may be developing new things, tweaking things that you already have, and the standards and measures are growing and evolving with the public health field. We're trying really hard to keep aligned. The standards and measures for reaccreditation are really designed to help with that. And so we hope that that will continue to make you more effective. This is the reaccreditation process. So there's 7 steps. The preparation step is first. So this could really start at any time in the process in that 5 years. Every department is going to be a little bit different and make this decision for themselves when they want to think about preparation. I kind of think you're in preparation immediately after you find out that you've been initially accredited, but that's just me, so you can take that or leave it. First thing you need to do is review the education resources. So we have for you just in time training that you can do in our learning center. It's called the Reaccreditation Journey, and it's a series of curriculum that really talks about the reaccreditation process and gets you information that you need to get started. We also recommend that you take time to assess your readiness for reaccreditation. What are you meeting? What are you not meeting? Reviewing those standards and measures, thinking about how you want to prioritize the work going forward so that you really know that you're ready when it comes time for your application. The next step is completing the application. You'll get notice from PHAB when we're ready for you to apply for reaccreditation. With that application, you have to submit a letter from an authority supporting accreditation, your table of organization, and information about your budget, but it's not hard. It shouldn't take you a lot of time to complete that application. After you've completed the application, you will get access in eFAB to where you can upload the documentation. With reaccreditation, you have 6 months to submit that documentation into eFAB. So a lot of departments start collecting that documentation, preparing that documentation, maybe even before you get to the application phase, because you know it's coming, you know the time frame, and so you're working towards that. Following that 6 months, your documentation is going to be reviewed. It's going to be reviewed by a PHAB accreditation specialist, site visit team. You will have a pre-site visit review report from PHAB. In that report, PHAB might ask you for additional information, for clarifying information, or potentially new examples. You have 45 days to respond to that request. So we really encourage departments to do as much as they can to have as few, hopefully, requests as part of that process so that 45 days doesn't feel like a real crunch time. Following that, you have a site visit. The site visit for reaccreditation is virtual, so that's a change from initial accreditation, and it takes place over 1 or 2 days. Following that, a site visit report is written. The site visit report talks about strengths, opportunities, and looks at each measure and how you demonstrated those. That report is what the accreditation committee uses to decide whether you will be accredited or receive an ACAR, which is an action or accreditation committee action. So there, the accreditation committee is going to identify specific measures where they're going to ask you to do additional work before you can be accredited. Once you're accredited, you continue in the cycle of annual reports that you've all been doing now. And then finally, reaccreditation again happens in the 5th year. We put together this chart, I hope will be really handy for you. I think it's pretty handy. Of the different steps and the timelines associated with them, there's also a few notes I want to point out. So you can see the 7 steps there on the left. We've talked about a lot of these things. Our accreditation committee does meet quarterly. So after your site visit report is ready, the accreditation committee will look at it at their next regularly scheduled meeting. You will know what that meeting is. The PHAB accreditation specialist will let an accreditation coordinator in a department know when that will take place. I also want to be sure to note in the annual report that the annual report is a great opportunity to continue to involve your accreditation team or a team of people really looking at how your department is addressing the standards and measures. It shouldn't be just the accreditation coordinator working on that annual report. And this will be in the slides, which you will get in an email. So I hope that it will be helpful to you. So let's talk now about what you need in place for reaccreditation. So first of all, similar to initial accreditation, you need an accreditation coordinator. If you have one, don't have one, these are kind of things to think about when you want to put that person kind of into that position. This person is going to organize your approach. So really think about how to collect the documentation, how it should be stored, and pull together the meetings that need to happen. The accreditation coordinator is going to need to raise up different areas of need. So really looking at what you have and don't have and making sure that the people who can help maybe fill any potential gaps have that information. We talk to accreditation coordinators about being encouragers, cheerleaders, and detectives. So encouraging the work, encouraging folks to kind of explain what they do to PHAB and maybe think about their work a little bit differently. Cheerleader, because it definitely helps if you can be a little excited about this work. And detective, because sometimes you really have to investigate, how does your department meet this measure? And what are the ways that we can continue to work towards this? We also really feel like the accreditation coordinator can help demystify the standards and measures for other people in your department. We know that the standards and measures are not an easy document to read. It's not like a real page turner. However, there's a lot of information in that standards and measures, and they can be intimidating. So the accreditation coordinator is able to work with us at PHAB and with your team to really help people understand what the standards and measures are asking for. We also think that this individual should be able to communicate why the work is important within their department. They're going to be asked to communicate this a lot and in different ways. So making sure this person is comfortable with that is important. And then finally, this person will be a liaison with PHAB. So any questions that we have, any questions that you have, are going to go kind of through that accreditation coordinator relationship. The health department director also plays a really important role in reaccreditation. You want the director to be able to communicate why the work is important to staff, to the governing entity, to different partners. As personal as you can make it to your health department director, I think the more persuasive it is, the more it helps with morale around reaccreditation. And so really making it personal can be really effective. As the department director, allowing time for the work, accreditation takes different amount of time, different amount of workers' time based on where you're at in the process. So really being aware of that and flexible with that. You may need to help shift priorities at some point. When I worked at a health department, my director helped me get some face time with some folks who are maybe too busy. And so that was a really I appreciated that. It was a great benefit from the health department director. Also, being a sounding board for the accreditation coordinator and the accreditation team. If they're having trouble finding something, if they are trying to get something that they haven't been able to get, and really just kind of serving in that capacity can be really helpful in helping to move the work forward. Eliminating any barriers that the accreditation coordinator or team might encounter, whether that's asking for different documentation from maybe different governing entities, or helping the time, space, those types of things. We really want the director to embrace a culture of quality. That kind of belief that we don't always have to do things the same way, that we can't afford to look at things differently, that we're not going to come down on problems, we're going to work on how to solve them is really an important part of embracing a culture of quality. And the standards and measures can really help withhold that culture and keep it going. So encouraging that from the top is also important. And then finally, I think it's really evident, but acknowledging the work of staff, right? Saying thank you in different ways and being cognizant to pass along that gratitude. You also are going to need an accreditation team. You don't have to use the same accreditation team that you use for initial accreditation. Some of those people may not be there. I also want to point out that once you're on the accreditation team doesn't mean that you always have to be on the accreditation team. So people may rotate on and off your accreditation team based on where you're at in the process. If you don't have one, or if you're looking for ways that you can build up your accreditation team, here are things I would think you could think about. So first, you want people on that team who can read and apply the standards and measures. So they're really willing to look at the document, look at what it's asking for, and really hold up the work of the department against those measures, and see how it matches up. You need people who are open to evaluating their current process, and looking for those areas of improvement. Volunteers on an accreditation team are often more effective than people who are voluntold, because that ability and desire to look at things differently is really important in moving this work forward. You want some people who can write narratives. With reaccreditation, there's an opportunity for you to provide more documentation in narrative form. So having some folks who are good writers, who are editors, would also be really helpful on your reaccreditation team. And then finally, you want people who are organized, who will follow the structure that the accreditation coordinator sets out, and really willing to work within those boundaries. You also need the standards and measures. So right now in the field, there are two versions of reaccreditation standards and measures. So version 2016, which look like this, and then version 2022. I'm going to talk to you a little bit about both. Anyone seeking reaccreditation now is under version 2022, but because we do have departments going through reaccreditation version 1.6, I want to make sure that we talk about that too. There have been some changes to the reaccreditation standards and measures from version 16 to version 2022. I'm going to cover those really quickly. So first, we brought back the standards. They weren't in the version 2016 measures. We also allowed those narratives or narratives of examples as documentation. Initially, reaccreditation and initial accreditation standards and measures were pretty far apart on some things. And so what we really have done is looked more at matching the format, how it looks, as well as matching some of the content, especially around those key plans. The strategic plan is a strategic plan if you're an initial accreditation or reaccreditation. And so we wanted to look at how we could make sure that those requirements are standard from initial accreditation to reaccreditation. It does look like more measures because we broke long measures into shorter measures. So it does look different. Just wanted to be sure we talked about that. There are a lot more details about the requirements in version 2016, trying to eliminate confusion, questions that PHAB got. There are also a lot more examples to help departments maybe think about the work. We also really worked hard to decrease repetition so that you're hopefully not having to submit the same document multiple times in multiple places. Version 2016 had 12 domains, version 2022 has 10. So some things had to move as we looked at aligning them with the new essential services. The strategic plan moved from domain 5 to domain 10, research domain 10 to domain 9. And you can see governance, ethics, and administration and emergency preparedness also moved. So they're not in the same domain, but they really are now under the essential services model in a different way. I want to talk to you really briefly about where the standards and measures come from. I think this is a really important question for you to be able to answer because yes, people are going to ask you. So a couple things to think about. First, the 10 essential public health services. So our standards and measures are based on the 10 essential public health services. The different essential services are our PHAB domains. You can see that equity is in the middle of the essential services model. There are equity aspects in all domains of reaccreditation in version 2022. You can see those core functions are still there, right? Assessment, policy development, assurance, and our standards and measures really apply to those as well. The 10 essential services are for the public health system as a whole, and really an important part of what we draw from in the standards and measures. The people here to the right, I really wanted to represent like the field of public health. Our standards and measures are all vetted through the public health field. They were originally written by the public health field, by public health practitioners and partners coming together to think about what those standards and measures should be. As we update and revise standards, we have opportunities for departments to vet the standards and measures, ask us questions, help us clarify, and we look at those comments and take into account as much as we can to make the standards and measures clear and work best for you. The other area that our standards and measures are really based in comes from the foundational public health services model. So the foundational public health services model is for governmental public health, where the 10 essential services is for the public health system as a whole. The standards and measures do not address the foundational areas specifically. Those are delivered differently in every department. What we really focused on are the foundational capabilities. So those blue rectangles, assessment and surveillance, community partnership development, equity, so on and so forth. The foundational capability measures are very important in version 2022 because in a way they're weighted more than other standards and measures or more than other measures. So you want to be sure that you're paying attention to the foundational capability measures in version 2022. PHAB has this cheat sheet that shows you which are the foundational capability measures. It's on our website. We'll be sure to get you that link. But you can see there's a column there for the foundational capability and where it appears in both initial accreditation and reaccreditation. I want to just be upfront and say, if you download the Foundational Public Health Services model, our measures don't necessarily match every detail of the foundational capabilities, but it really is, we wanted to match the spirit of those foundational capabilities, and I hope that you will see that alignment. This is the language in the reaccreditation policy that talks about how we look at those foundational capability measures and why I say that they're weighted. So we really are looking at those as the accreditation committee, and it says that we will need to demonstrate conformity with the foundational capability measures. It's on page 8 of the policy if you want to take a peek. All right. One more slide and then I'm going to take a break for questions. So what's in the standards and measures? If you're not familiar with our standards and measures, there are a lot of things in them. A couple of things I wanted to highlight today. So foundational plans, when you think about public health infrastructure. So a community health assessment, community health improvement plan, a strategic plan, a workforce development plan, those kind of plans that a lot of your infrastructure can be driven by are part of the standards and measures. There are different policies and procedures that we ask for as potential documentation. There are also several places in the measures where you have to talk about your collaborative efforts, who you partner with, what that partnership looks like, what you do, what they do as part of the standards and measures. We do look at enforcement and enforcement programs that your department has. Emergency operations plan, including surge capacity, is part of the standards and measures in that area. We look at interaction with the governing entity. So how are they aware of what's going on in the department? How are you keeping them kind of aware of their roles and responsibilities? Health equity is throughout version 2022 in each domain. And additionally, there are requirements around employee recognition and retention in the standards and measures. So before I go further, I want to stop. Amanda, are there any questions that we should talk about?
Yeah, there are two. So the first one says, what is the typical time for review of the uploaded documents before the pre-site visit report is sent?
So my understanding is, I'm not from that team, but my understanding is we aim to have that back to you in about 2 months, but I will seek clarification and make sure that I have that information correct, and we'll get it to you in the email that follows.
And then the next question, is you mentioned that the foundational capabilities are weighted. Are some weighted more than others? Is there a scoring sheet / rubric available?
They are not weighted more than others. The foundational capabilities are the foundational capabilities. The measurement scale is not demonstrated, slightly demonstrated, largely demonstrated, fully demonstrated for version 2022. For version 2016, it's met or not met. So that is also a change. And there's not necessarily a rubric I can give you, but that's the scoring process. I hope that helps. Okay.
Yes, to clarify in the chat, yes, it was 2 months. It's based, I believe it's based on the workload of their accreditation specialist, but around 2 months. And then there was another question in the chat that said, is there a workbook or a checklist for reaccreditation that PHAB has put together?
Regarding the process, we have a couple different tools I'm going to talk to you about when you think about completing a self-assessment, in Excel tracking spreadsheets. You can track documentation. I'm hoping that answers the question. If not, if you could ask us a clarifying question, that would be awesome.
She said, yes, thank you. Okay.
Okay, cool. All right, so let's keep going. Thanks, Amanda. I wanted to show you what the standards and measures look like. So this is version 2016. It's from domain 10. The measure is Health Department programs and interventions based on the best available evidence. You can see that there are requirements. So this is what PHAB is looking at your documentation against. The guidance really gives you further information about those requirements. It tells you what kind of document it could be, whether it's a narrative, an example, a policy, a plan, and then that dated within. So 5 years is the general accreditation timeframe, but as you can see here, some things have more frequent requirements. Version 2022 looks pretty different. I want you to note that this is a foundational capability measure. So all of those are going to be flagged with this rectangle in the standards and measures document. This is measure 10.3.3a, access and use legal services and planning, implementing and enforcing public health initiatives. The purpose and significance section, I think, is really different from version 2016. The first part of the purpose and significance really tells you, why is PHAB looking at this requirement? Why is it important for accreditation? And then the second part of the statement is about why it's important to public health practice. If you have folks who are struggling with, what do we do to meet this? I really recommend that you go back to the purpose and significance, look at why it's important for public health practice, and then think about how your department does that. How do you achieve that? I find also that people sometimes skip that purpose and significance, but I encourage you to take a couple seconds for a minute and read the section as you go through the standards and measures. Then here is the measure and the required documentation. So we can see on the left in the dark gray column, again, these are the requirements, and there is additional information about those requirements that's going to be provided in that dark gray. The light gray, the guidance section, is where you're going to see more examples and more kind of justification about why PHAB is looking at it or why it's part of public health practice. A couple of things I want to point out, because it can trip departments up, is that engagement with legal counsel could be demonstrated, for example. So just could be demonstrated in, for example. It doesn't mean it has to be one of these examples that PHAB lists. These are merely here for ideas, for kind of brainstorming how you meet those measures. So really, we caution you not to tie yourself that it has to be one of those things listed. That is not the case. So pay really close attention to those words. You can see with number of examples, we need 2 examples. You can provide narratives of examples or a description of the process. In this case, it doesn't necessarily have to be like notes from your engagement with legal counsel. And it has to be dated within the last 5 years. I picked measures that were 1 page and pretty short to talk through today. Some of them have more course required documentation and examples required, but hopefully you get the idea of how they're structured and what information is available. Here are my tips for reading the standards and measures. First, really watch for small but important words. And, or, and must are huge and really tell you a lot about what's required by PHAB. We did a lot of bolding and underlining of some of those small words. We didn't underline it or bold it every time, but really pay attention to that as well. It's going to give you important information. And then I use this picture because you kind of sometimes get yourself in a rabbit hole with standards and measures. So don't read too much into it. The measure is the measure is the measure. The requirement is the requirement. It's really easy to make it more than what this measure says. We call it PHAB bringing it my department, where you kind of overthink something. So really just encouraging you to read the measure for what it is. If you have any question about what a measure is asking for, we really encourage you to reach out to PHAB, to the accreditation specialist team, and ask them. We'll give you that email later because we don't want you stewing about it. There's no need. We would more than happy to answer your question. I also want to talk really briefly about PHAB scope. It has changed significantly. The new scope policy was adopted in 2021. These are the things that PHAB accreditation does not cover. So I want to point out the first and the fourth bullets in particular, because I feel like those are the biggest areas of change. So individual patient care and clinical protocols governing provision of care to an individual. Sometimes WIC kind of was a program where it was hard sometimes to know if it was in scope. With this, you can use WIC documentation when you're talking about a farmer's market awareness or how you're addressing kind of wait times at the clinic. So anything that does covers all of WIC would be acceptable. However, you're meeting with one individual child and their caretakers is not what you would provide as documentation. Also, the program's designed to improve health or well-being of animals. That was one that we sometimes got questions about. When you think about like a rabies vaccine campaign, that totally works versus administering an individual vaccine to a dog. The policy you can see here on the right. My favorite part of the policy is the end of the policy because it gives examples of what is in and what is out of scope. And on my next slide, you can see the different examples. These are directly from that policy document. And really, I think go a long way in defining kind of the scope and the change of scope that we have had from version 2016 to version 2022. There are a lot more examples as part of the policy, and I hope that you will take a look and encourage you to take a look. Also, you're going to need documentation. So remember, your documentation really informs your site visit report, just like with initial accreditation. And your site visit report is all that the accreditation committee has to make their decision. So the stronger your documentation is, the stronger your report can be, and hopefully the easier decision for the accreditation. You still have to have authentication of documents, dates on documents. Be very careful about acronyms and explaining them. Not everything means the same to people from across the country. There will be people potentially long ways away from you that are looking at your documentation. Really watch out for any insider knowledge or terminology. What's something that means something to you in your department but may not mean something to anyone else. So in my department, a lot of the reaccreditation work took place on the X drive. And if I just talked about the X drive, that doesn't mean anything to anyone else except for the people who know about that. So really think about those things. You cannot submit a draft. That hasn't changed. You need to be within PHAB scope. And you really want to do your best to make obvious what you want site visitors to see. You want to make their job as easy as possible. And we offer a reaccreditation documentation intensive class that we love to have departments working on reaccreditation take, where we kind of dive into how to do that. It's completely optional, but want you to know it's out there. There are different types of documentation that are asked for with reaccreditation than you experienced with initial accreditation. So adopted items That's pretty much the same, right? So that's your health improvement plan, your strategic plan. It could be documentation of an example, a narrative of a process, or a narrative of an example. So that narrative gives you the ability to maybe tell a story where you don't have documentation that you could provide. So we're really hoping that it gives you a wider kind of spectrum of things you might be able to pull from as documentation in different areas of your department that you hope to feature. We get a lot of questions about how does accreditation, reaccreditation work in small health departments? And there's not one easy answer. There are small health departments who have gone through accreditation and reaccreditation. These are things that we hear from them that we try to pass on to others. But it really is about adopting a small but mighty mindset that can really help in moving the work along. It's an all hands on deck, right? Getting as many people as possible, bringing in partners to help. Using being small to your advantage, it does make it easier for communication and organization. And then just not kind of worrying if you don't have something, but if you don't have something, think about what your plan would be to do that. All right. Amanda, is there any questions we need to answer?
Just one popped in. I heard recently that there's a new version after 2022 coming up. We will be going through reaccreditation in 2028. Will we have to substitute out the new version?
So I don't know the time frame, but yes, we're starting to work on version 2027. And we would publish the time frame of when folks would be required to move to version 2027, just like we did with version 2022. So to my knowledge, that decision hasn't been made yet, but we do know that there will be a version 2027.
Okay. And then we got questions. I'm going to put the link in the chat for the documentation intensive class that Joy was talking about. It is free of cost to anyone who is actively involved in the PHAB process, so accreditation or reaccreditation. And there are dates and registration links in the link that I will put in the chat and also in the Q&A. Thank you.
Thank you. So really quickly, the reaccreditation site visit looks a little different. It is a virtual site visit, so that means you need to figure out kind of technology early. I would encourage you to think about that. There will be an agreed upon agenda, so you're going to know kind of who needs to be there and who needs to be in the room. Similar to initial accreditation, the purpose is really to answer PHAB's questions. And then you can also provide additional documentation if asked during that site visit. Also, a big change, work that you do after you submit documentation can still be submitted up until the site visit. So that is a big change, but want to be sure to pass that along as well. If you're planning for your site visit, if it's coming up, or maybe it's a little ways out, here's some things to think about. Who's going to talk about what, and really making sure that those people know the measures, know what documentation's been submitted. Your pre-site visit review findings, what PHAB asks you for after that initial documentation submission, are really going to give you hints of where PHAB has questions. So you want to think about those areas, determine those technology needs. You could do a site visit prep session with PHAB. So this is something we're able to do through technical assistance. So it's completely separate from our accreditation and recognition team, led by our Center for Innovation. And we can help separate from accreditation, helping to do those prep sessions and talk to you about how to prepare. It's important to think about your communication plan and what you want to let all staff know about the process. Really think about that celebration and making it fun. That goes a long ways into keeping people interested in the work. I also want to continue or encourage you to think about accreditation as continuous quality improvement. The annual report process can really help you to move that along. There's a new-ish section of the annual report. I'm guessing most of you have seen by now, but the reflection and learning section of the annual report really is where you can kind of pick and choose what will be helpful for you to move the work forward. Documentation review can happen any time. So you would develop the documentation just as you would to upload an eFAB, and PHAB will review it and provide you feedback. Reflection reports are about domains or foundational capabilities, and then us providing feedback. There's a template for that. QI project review, where you can send us how a QI project went and the documentation you would use, and we will answer questions and provide feedback about that. Participation with PHAB you can use once in the accreditation timeframe, but if you serve as a site visitor, serve on a PHAB committee, that could be what you do for the annual report for this section. And then reaccreditation readiness is available in years 3 and 4, where you can do a readiness assessment of your department's ability to meet the reaccreditation standards and measures. You would submit it to PHAB. We go through that, provide a pretty lengthy report with each measure, any recommendations or notes. You have the opportunity in that document to ask us questions. And so I would really encourage you to think about doing that. It's really helpful. You also could consider a reaccreditation plan. There are different things that you could include. None of this is, of course, required, things you could consider, but think about what your department priorities are. You can look at your initial site visit report to help determine those. Think about what your work plan might be, how you're going to check in on accreditation progress. And one I really want to point out is that orientation of new staff, leadership, and the governing entity. Really thinking about being purposeful about that, how you'll do that. When you have subject matter experts leave your department, what questions are you asking them about documentation that they may be responsible for? And then how are you passing that information on to the new person taking their place? And how are you helping them to understand the requirements of the standards and measures? Other things you can think about with that reaccreditation plan: what are your priorities for the work going forward? Is it new or ongoing work? That kind of really looks at new work potentially taking longer than ongoing work, but just thinking that through. Kind of looking high level at what are the key steps to completion, any barriers, expiration dates on those key plans, and being aware of those. And then any documentation that you're going to use with partner ownership, thinking about how you would get that from that partner, who your connections are there, also can be part of that reaccreditation plan. PHAB has several resources that I want to be sure to pass on when we think about reaccreditation on our website. The standards and measures, I think, are primary, right? Everything is in there about what's required. That's what the site visitors use to look at your documentation and determine if it's met. So you just really got to dive into those standards and measures. The policy documents look at kind of the process from beginning to end. Your rights, if you need an extension, that process is all part of that policy document. We have both a glossary and an idea glossary. IDEA stands for inclusion, diversity, equity, and anti-racism. So both those are available related to terminology used in the standards and measures. We have that crosswalk with the foundational capabilities, trying really hard to make sure you know what those foundational capability measures are. The fee schedule, and then documentation forms. So documentation forms we haven't talked about, but each measure, and actually each example, is required to have a documentation form with version 2022. That documentation form is a cover sheet where you let the site visit team know where you want them to look within the documentation, and really helps you kind of have a space to provide context. I think that the documentation forms are also a really cool way for you to make sure that you're getting kind of the ands or ors as part of the standards and measures as you read them, because they break it apart into each separate requirement so that you can address them in the documentation form. So I really would encourage you to look at those. If you have a team that's maybe struggling with a requirement, just printing off and looking at that documentation form might be really helpful. Those are available on the Learning Center. These are pictures of our glossary of terms. I have to say that we do not endorse any specific vendor, and we're always working to have more resources on the website and in the Learning Center. I want to point out and help you remember that your accreditation specialists are also a great resource for PHAB. So this team answers questions about the intent of the standards and measures, the process, PHAB. They can help prepare you for the site visit. And they really assure that the content of the site visit report is strong and gets to what the accreditation committee needs. You are assigned an accreditation specialist once you submit documentation. So until then, we ask that you ask any questions to this Ask PHAB email address. And then once your department submits documentation, you'll have your assigned accreditation specialist and work with them through the process like we did with initial accreditation. For education and training on our website, we do have live training. So reaccreditation documentation intensive. Ooh, that was a lot to say. I already talked about. We also are providing new accreditation coordinator training. So if you have someone new in the role, if the hiring staff person has to hire a new accreditation coordinator and is curious about the position, we've had some of those folks attend this training. It's a 2-hour training where we really talk about the role, the standards and measures, and hopefully give people a good start and orientation to the role. In our Learning Center, if you are reaccredited, anyone in your department has access to our reaccreditation journey. You just have to let us know who needs that. And documentation forms are there, the report on the annual report and its requirement, and then kind of the accreditation newsletters that PHAB puts out are also there. So you have that history. You can look back there if you have a question or you think you saw something in a past newsletter. You can reach education at educationservices@phabboard.org. Amanda and I monitor that email, and we would love to talk to you more about training. And then I also put the Ask PHAB email here again. It's a really important one to have, and again, hope that you will use it. This is a slide I use in a lot of trainings. I think that it's important to never forget these 3 things when you think about accreditation or reaccreditation. First, it's a journey. There are big steps and there are small steps, and recognizing that and kind of being upfront about it is really important, and really celebrating those tiny steps forward can be really important. That confetti there is for celebrating, taking the time to express gratitude, taking the time to hopefully make it fun and think about how you can use this as an opportunity to increase staff knowledge is really important. And then finally, accreditation, reaccreditation sometimes is just planting a lot of seeds, right? It's not always a big tree right away. So it's really thinking about how can we move this work forward? How can we think about it differently? And maybe you can't go as far as you want to go right away, but you can take a step in that direction. So I'd encourage you to keep those 3 things in mind as you think about reaccreditation. Sometimes, some days it's harder than others when you're working in accreditation. So keeping these 3 things in mind, I hope will help you. And then I have about 10 minutes for questions. So we should do that now.
Okay, there are many.
All right.
So for Michelle's question, yes, we do have new documentation forms. However, if you already have many of them filled out already, PHAB is not requiring you to totally redo them. You are more than welcome to submit the previous documentation forms. You do not have to redo them. So hopefully that eases the worry of having to do more work and redo everything.
Yes.
Yes. Okay. So I'm going to clear up if I didn't answer your question in the chat, please put it in the Q&A for this session. I tried to get through as many as I could, but I might have missed some in the chat. So if you are able to open up the little Q&A box on Zoom and put it in there, that would be awesome. But if not, I will try to double check the chat so we can get all of them. Okay, so there was a question related to in the chat that I wanted to find. That I cannot see. Oh yeah, okay, here it is. Sorry, it's hard to scroll.
You're all good.
It's from Asma, and it kind of left me. I can't find it again. Okay, here it is. Is there reciprocity for other programs? For example, state accreditation or Project Public Health Ready?
So there is some information about Project Public Health Ready in the standards and measures that you can take advantage of for some departments. We can get you that language, or we could include that language in the follow-up. There is not reciprocity with state accreditation systems with the PHAB standards and measures.
And then another question was about when you were talking about partners and bringing partners in to help. Can you explain what that means, bringing in partners to help?
Yeah, so partners oftentimes can bring data to the table that you might need. They can help carry out strategies. They maybe can help with communication. Sometimes it's community coalitions that you work on, addressing different populations or issues, like singular issues, like maybe cancer or tobacco use. So thinking about kind of where you engage with partners to do the work that we talk about in the standards and measures, and really thinking about how you work with those partners, how you kind of bring public health to the table in those situations, and being able to explain how you maintain those collaborations and partnerships as part of the standards and measures.
Next question. Is there a link to make a request for the site visit prep class?
So those requests right now need to go in 5. That's a process available through the Public Health Infrastructure Grant. So that would be my recommendation there.
Okay.
If you're not a grantee, if you could email Ask PHAB, that email address, then we can maybe look at a different process.
Thank you. When were new documentation forms released? Where can they be accessed?
So was it last month, Amanda?
Either last month or the month before that. Time goes by so fast.
So they are on the Learning Center now, the updated documentation forms, but Amanda and I are currently in the process, Amanda primarily, of pulling them apart so that you can not have to separate a whole domain of documentation forms and kind of breaking them down into smaller chunks, hoping to make it easy for you. We are hoping to do that by the middle of July. So we're working towards that and are making that available kind of as we have it ready.
And
I hope it helps.
Yeah, we had a couple of questions. I typed this in the chat, but I figured it would be helpful for me to share it out loud too. So the new documentation forms are relatively the same. There's just very small changes. So they include updated wording in the date boxes to help departments better provide those dates within the required timeframes within their narratives. And to emphasize that when an example is provided, multiple dates may be located in the documents to use to demonstrate conformity with the requirement. So such as like on emails, meeting minutes, reports, agendas. So it's not a huge change. And again, just emphasizing that if you already have documentation forms filled out that were the old version, you can still submit those. That is totally fine. Okay. And then the next question is, can we ask specific questions on the domains? Is that maybe that's referring to the reaccreditation readiness assessment, or maybe to ask PHAB, or like so it's an anonymous attendee too. So anonymous attendee, maybe you can.
So my advice would be, if you have questions about a domain, a measure, that you reach out to that Ask PHAB address. If you leave a more specific question in the questions and answers, we can try to get back to you as well. But I guess I would start with Ask PHAB if you have specific questions about maybe what a requirement is or what PHAB is looking hope that answers the question.
And another, so someone asked if the documentation forms are going to be sent directly to accreditation coordinators or a link to access. So they're going to be in the same exact place in the Learning Center in those documentation form courses. So the reaccreditation documentation forms. So just be on the lookout for them, like, you know, in the very beginning of next month / end of this month. And then we will announce them as well in in our accreditation newsletters too. But the best way to be in the know is that you now know the information and then you can keep an eye. But
You
they
know
will be
first.
announced in a newsletter too, so you'll have that formal notification as well. And then we have, those were our ones in the Q&A. And then there's several in the chat, so I'm going to look through that. So if you're having problems uploading documentation in eFAB, we would definitely recommend reaching out to AskFAB at fabboard.org, that email address.
They can talk you through it.
Yeah, they're great, and that we've heard their turnaround time is awesome as well. Our health department was accredited for the first time last August. Congratulations.
Yay.
Is the annual report process difficult?
So I don't think it's difficult. There's steps to it. The annual report course, I hope, lays out really clearly the expectations. For me, I think the hard part is going to be picking which reflection opportunity you want to use that will help your department move forward. It doesn't have requirements around quality improvement and performance management in the way that it had previously. So I feel like it's a lot more flexible than it used to be, which if you're newly accredited, that doesn't mean very much. But it is going to take a little time. I hope you'll use the opportunity to tell your story of where you're at and have a couple people pitch in to help with that annual report. You can do it.
Yes. Yes. For our last 2 minutes, I think this might be our last question. In the event a coworker is working on a particular measure, they submit what they believe meets the requirement. However, it would not meet the requirement. Sorry, it's jumping around. Is there a way to ask that question to AskFAB?
So, you can't provide documentation to FAB and have them review it, other than if you would use the annual report process to do that. However, you can kind of ask a question of FAB that's like broadly describes, this is what we're thinking about, providing, these are our questions, what feedback or help might you be able to give to us. I would also just encourage you to kind of work with your team to look at the documentation, think about maybe what could be different. And I know sometimes it is hard to have those challenging conversations. Yeah, I hope that helps. Good luck.
And for our last thing, our other FAB colleague on with us, they shared that it might be helpful to mention that CFI is offering technical assistance through FIG and other services.
That's the Center for Innovation is offering technical assistance. They are doing documentation review. Again, that's the request through 5 and able to look at documentation and provide feedback. Again, separate from that accreditation arm of FAB, but hopefully helping answer some of those questions. Thanks, Rita. Well, thank you so much for all of your questions. Thank you for spending time with us today. If we missed anything, we'll be sure to get that out to you and have the slides out to you by the end of the week. Thank you for all the questions. And again, thank you for spending time with us today. And we will see you soon, hopefully. Thanks everybody.